This administration says that Obamacare is fixed. The reality, not even close. With me, Professor Emeritus of Neurosurgery at Johns Hopkins University and Fox News contributor, Dr. Ben Carson. Dr. Carson, is Obamacare website fixed?
Well, I guess it depends on how you define the word fix. And we know that there are some people who like to do redefinitions of everything. So according to their definition, yes, it would be fixed. But, you know, we have to ask the question, what really works for the American people? You know, we're in a situation where 85% of people had health care that they were satisfied with, and we've turned the whole system upside down for the sake of the 15% who did not have it, and there were certainly many good ways to take care of those people.
And Dr. Carson, let me ask you this. Did you hear in my open I was talking about the woman, Maria Silva, who's a stage 4 a cancer, breast cancer patient who was happy with her health care, had a scheduled round of chemotherapy, and then gets notified she lost her insurance. She goes to the doctor. He says, you have no insurance, ergo no chemotherapy. I mean, how many Americans are like this, are in a situation, this limbo, where, I mean, they need life-saving treatment, and they need it now?
Well, one is too many. And we have a situation now where we're talking about millions of people. And whether that represents 1%, 5%, 10%, you know, one is too many. We have to get away from this mentality that, you know, you don't really matter. We're looking at this group of people. This is never what America was supposed to be. And it is important for the people of America themselves to start having compassion for each other. Because if we allow the government to take a segment of us and say, you're not so important, but I'm going to take care of this group, then we are just as guilty as the bureaucrats in the government.
And, you know, Doctor, when you say that the American people, I mean, obviously they care about each other and they care about their own health care. I mean, can you fathom ever in history of hearing an administration say, oh, well, it's only that 5%, you know, it's only 15 million people, you know, not a big deal. It's almost like, it was only 4 guys in Benghazi. We didn't send the troops. I mean, it's just, to me, it's shocking.
What we always say in surgery is maybe the risk of something happening is only 1%. But if you're that 1%, for you it's 100%. And we need to be looking at it that way. And you know, it seems to me that if the government wants to fix a program, why not offer something that is so good that people flock to it, rather than something that you have to twist people's arms to go into? Isn't that the way that America has always been? Isn't that the way that things were established?
And the problem, as you well know, Doctor, is that, you know, we're going to rely on young people, and I have a 24-year-old son, you know, and in a couple of years he'll have to buy insurance, but, you know, they all think they're invincible, they're infallible, I mean, everything is fine, and they don't need health care, but if they don't buy it, then seniors and other people are going to lose their ability, you know, to get the treatment that they need. I mean, of
course, but of course, you know, if the young people can stay on their parents' insurance until they're 26, then why would they bother to be looking to get onto the insurance themselves? You know, the system actually works against itself. And I'm not sure that anybody has really put a lot of thought into this thing. I think it was really more an issue of what can we do quickly in order to gain control of health care, because that is such a huge portion of the budget and such an important factor. We have turned over to the government way too much. This is a wake-up call for Americans.
You know, I recently, just a few weeks ago, I had a triple hernia surgery. That was a real hoot. But I must tell you that all of the doctors ahead of time and then surgery, they wanted money in advance. I've never seen it like this before. I mean, usually, you know, submit to your insurance. I mean, are we going to see more and more doctors opting out of plans and not willing to care for us, and more people having to go to second-tier hospitals now?
Yeah, well, it's already happening. You know, 7 out of 10 doctors and portions of California are opting out of the exchanges. They don't want anything to do with them because, you know, the rates of payment are so low, it doesn't even cover their cost. So if you have a practice and you can't cover the cost of it, of course you're going to be very concerned about how you're going to be paid. bear in mind a lot of the young physicians, you know, they're coming out of the medical school owing $100,000, $200,000, $300,000. How are they ever going to be able to pay that back when the government wants to pay them peanuts? I wish some of those people could spend as much time as it takes to become a doctor and to become a specialist and see how they feel about it.
Well, and Dr. Carson, final question. Do you see yourself running for president in 2016?
Well, I see myself as continuing to go around the country and talk to people about what America really is. I'm very hopeful that someone will come along who really understands who we are, and somebody that I can get behind and really push along with everybody else. It's way too early
yeah,
really
but someone you can get
that.
behind. I mean, can you get behind yourself?
We'll see what happens. I would prefer not to be honest with you. I would prefer it to be someone else. But I am also very concerned about our nation. I'm concerned about the next generation. And I'm confident that we're going to find a way around this.
And you know, Doctor, there's no question that you're concerned. I mean, and that's how you first really came onto the national scene. You just went out there and said, this is wrong, I'm a doctor, and this has to change. Dr. Carson, thanks so much for being with us tonight.
Thank you, Judge.
All right. And coming up, we already know you can't keep your doctor, but is there any doctor that you'll be able to see? The dangerous shortage we may be facing next.